So the basic questions you're going to ask on each EKG, what is the rate, right? So that's the rule of 300 or the rule of 1500, like we talked about last time. Is the rhythm regular? In other words, are the complexes about the same distance apart every time? Okay? So rhythm, like you learned in elementary school, right? A rhythmic pattern is there's about the same time between each beat, right? So if you have a heart that is beating in such a way that there is a different amount of time between each beat, that is an arrhythmia, right? It is not rhythmic. So for today, all we're going to ask, or all you're going to ask is the rhythm regular? In other words, are the complexes about the same distance apart? Okay, then we talked about P, Q, R, S, and T last time. I need a marker. I guess I can just draw in here, can't I? Right, so P, Q, R, S, T, right? P, Q, R, S, T. Okay, so the labels. We label EKG, the squiggles are complexes, right? Squiggles doesn't sound very professional, so we say complexes instead. All right, so the first deviation from baseline is P, right? So that's this wave. Then we have a down and up, a down and an up. Well, each change in direction gets a label. So the Q is down, R is up, S is down, and then we have T comes up above the baseline again. Okay, so when I say is there a P wave before every QRS, is there a low hill before each big mountain, right? So is there a P before every QRS? Why is that an important question? P wave is atrial depolarization. QRS is ventricular depolarization. In a normal working heart, one occurs before the other. The atria contract and then the ventricles contract, right? So if you have an EKG where you don't see a P wave before every QRS, it means the atria and the ventricles are not working well together, right? So we would see that as an atrial problem usually. Are the QRS complexes narrow? Okay, in my terrible picture here, I wanted to show you the details, so I broadened it out. A real QRS takes place in a very short amount of time. Why? Conducting system is very rapid in the ventricles. Okay, so the QRS complex in a normal EKG should be very narrow. If it's widened, that's pathology. Okay, you've got a problem either in the conducting system or in the ventricle itself. Okay, so that's 1, 2, 3, fourth question. Fifth question has to do with the ST interval. In other words, the space between the end of the QRS complex and the beginning of the T. In a normal, happy, healthy heart, that interval is flat and isoelectric. In other words, it's at about the same baseline as all the other flat parts of the EKG. When we see that ST interval start to change, in other words, take on a different shape, we get concerned for possibility of myocardial infarction, right? So we would call that an ST elevation or an ST depression. But for today, those are our questions. All right, so let's look at some examples. All right, so first off, what is the rate? How do you prefer to calculate the rate? Do you like 1500 or 300? 50, that's why there's two, right? I don't like 1500 because I don't like to memorize the list. So if we do, so we'll pick this complex and this complex. There's about 4 big boxes between those. Each big box is 5 little boxes, so that's 20 boxes. 20 little boxes, 1500 divided by 20, if I'm right, is about 75. Right? So that's our rate is 75. Happy with that? What's a healthy heart rate? Yeah, 50 to 120, right? That's a nice broad range. I say why 50? I've met some Marines, okay, and like they're very in shape and their hearts just like beat, right? Because each time they beat, it's like a bunch of cardiac output. So you can get low heart rates, particularly in very fit people. And remember, children have higher heart rates than adults do. The smaller the creature, the faster the heart rate. You know, so like your desert mouse ticks along at like 200 beats per minute, right? Because they're tiny. Big blue whale, probably like 50. Okay, so that's rate. Is it regular? Are the complexes about the same distance apart? What do you think? Yeah, close enough. Remember, it's never perfect. We're not computers. We don't run on a clock, okay? So as we breathe, as we move around, as entropy happens, okay, you're going to have subtle variations. That's not what we're talking about by an arrhythmia. In arrhythmia, you have significant variations in how far apart the beats are. Okay, now a trickier one in a real EKG. Is there a P wave before every QRS? Yeah. So here's the P waves. They're little, right? Very tiny. And in some leads, they're very hard to see, to be honest with you. So like there is, I believe, a P wave in there. But here's another one, here's another one, here's another one. So yeah, in general, there's a P wave before every QRS. T wave, you can ask yourself, is there a T wave after every QRS, right? Less important question, but a decent question instead. I took that one out. Is the QT interval flat? Right? So back up between Q and T. So what do you think? Is it entirely flat? I would say no, actually. I'm not convinced this is a full-on STEMI, but there are some ST changes, right? Those of you who have more electrophysiology experience than I do would probably be able to tell me exactly what it is. But there is a little. Okay, is the QRS interval narrow? That's not even on my list. Is the QRS narrow? Not as narrow as it should be, right? So the QRS is a little widened, okay? Now the fun part is what's the vector? Anybody practice over the weekend on the vector? Or you just had your heads in anatomy? Had your heads in anatomy. Anybody remember the super easy way to do the vector? So what's the vector on this one? The thumb one? Somebody want to walk us through it? No? Huh?
A positive and a negative is a normal.
Okay, so is that what we have here?
So that first part would be the positive, and then the second would be the negative because it drops down below.
Mm-hmm. So is that a normal axis?
Yeah.
Yep, good. See, that was easy. All right, so not an entirely normal EKG. You don't have a diagnosis yet. That's fine. All right, the first part of any diagnostic evaluation is it normal or abnormal? Okay, is this normal or abnormal? Abnormal. Widen QRS. We have some ST changes, right? So this EKG is going to need further evaluation. All right, so let's do the process again. I'm going to add, no, I forgot, I don't really need those. Well, I'll just remember. I want to do all of the questions, not just the ones I have up there. Okay, so different EKG. So notice, same arrangement. Okay, now, a variance. You can see in this EKG, we have 3 leads at the bottom, right? So these go all the way across. Whereas 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. This is your 12 lead at the top. The top 3 lines are uniform across all machines, okay? How many and which leads you get for your, we call these rhythm strips, where we see one lead over a longer period of time. This is variable, Okay, you can set the machines differently to get you different views. Okay, so remember lead 1, 2, and 3, AVR, AVL, AVF. So these are our Cabrera circle leads. Okay, so our frontal plane circle. V1 through V6 are our coronal plane leads, right? So they're giving us the pictures in that plane. Okay, so first off, what's the rate? There's, let's see, 1, 2, 3 big boxes and 1, 2, 3, maybe 3 little boxes. So that's 15, 18. What's 1500 divided by 18? 90-ish, 80-ish, 90-ish. Huh? 83. So is that a happy rate? Happy with that rate? Okay, so rate is within normal limits. Is it regular? Are all the complexes about the same distance apart? They are. Is there a P wave before every QRS? It's harder to look at, right? Because in some of these leads, like lead 3, very isoelectric lead. So you kind of got to squint and look funny at it, but there is a P wave there, okay? You'd be more concerned if you couldn't find any kind of deviation at all ahead of the QRS. Is there a T wave after every QRS? Yeah, generally speaking there is. Well, every time there is, in fact. All right, is the QT interval flat? This section right here. What do you think?
It's really narrow.
No, I'm talking about the between the QRS and the T. That's flat, believe it or not. Remember how I said you have to give up black and white? Okay, that is flat. We would not be concerned about that particular ST range. Now, is the QRS narrow? Yeah, it is, right? So what does that tell you? It tells you that your conducting system is working, right? And that your ventricles are going to contract all at once. All right, so what is the vector normal in this one? The axis is just another name for the vector, right? So normal vector. We'll ignore the P waves question. That was from, I mean, I can tell you, why are the P waves small in V4 and V6? Where are they? You see how tiny they are? Right? Anybody have any ideas? Where are V4 and V6? They're back here, right? On the opposite side of the ventricles from the atria, right? So why are they so small? Because they're far away. Okay, in those leads, they're distant. Okay, so that was so normal EKG, abnormal EKG. Normal, right? So P, QRST, that is how we should see this. There is maybe a tiny little bit of ST depression there, but not anything we're going to get worked up about. Okay, here's another one. So what's the rate here? Anybody want to grab that one? 1, 2, 2 big boxes and 3 little boxes. We just did that one, didn't we? No, we didn't. So 13. 13 divided by 1,500. 110. 120. 115. Right. So heart rate of 115. What do you think of that? A little high. What if I told you this was a 1-week-old? Normal, because this is a 1-week-old EKG. Yes, 1-week-olds have hearts that work just like ours do, right? One of the things you see in pediatric EKGs, look at the height of that thing, right? That big, tall QRS complex. A lot of times, children's EKGs get labeled as left ventricular hypertrophy, like they've been having high blood pressure for 20 years, when they've only been around for a week. So what this really is the fact that babies are so small that the leads are very, very close to the heart, right? So we get big lead in V2 and V3 in particular, because like the heart is literally right there. Okay, so rate normal. Is it regular? Are the complexes about the same distance apart? Yeah, and the nice thing about a pediatric EKG, you have lots of complexes to look at, right? So you can really tell that they're all pretty much the same distance apart. Is there a P wave before every QRS? Yeah, there is. Okay. Is there a T wave after every QRS? Harder to tell some of these. You have to use your imagination a little bit. T, T, T. Is the QT interval flat? This is a good. This really does show you nice and flat. Like, gotta love this. The baby is like, yep, I have absolutely no ST elevation, which I shouldn't have. What do you about vector?
Looks like super rare.
It's a baby. So yes, their vectors are usually abnormal, just because of the way they haven't grown into it yet. You notice I'm skipping over axis on purpose. It's because axis really isn't very important. Okay, I'm more interested in the top questions first. Okay, I promise I will not ask you to calculate a vector or an axis on an exam question, okay? The axis made simple thing, you know, the little video thing, I might ask you to use that information just because I do want you to learn that system because it will make your lives much easier later on. Okay, vector we did. P waves. Okay, so our QRS is narrow, our QT interval is flat. We have a P wave before every QRS, our rate is normal, our rhythm is normal. So what do we think of this EKG? Right, normal EKG. So when we talk about that, we use the phrase normal sinus rhythm, right? That means that the heart is contracting and depolarizing and repolarizing like it should, and that the SA node is in charge. So this would be a classic example of that.